and it's great to be with you guys. It's too bad we can't do this in person, of course, but such is life. So I'm going to share my screen here. I'm going to try to get this talk up. Let's just see here. Let's try this again. Miss Ashton and Miss Collins and a few people asked me to give a quick talk today, so I'm happy to do that, and hopefully you guys can find this helpful. And really, as you know, this isn't a certification course or anything, but hopefully you find it helpful, and you never know, maybe you can find it useful as early as today if you run into a problem or emergency. And so I'm happy to share with you guys, and happy if you want to ask questions during the talk. We'll hopefully have some time afterwards to talk more about anything. So as was mentioned, I'm happy enough and privileged enough to be an intensive care doctor for babies. So that's what I do. I look after babies that are sick. And I also have a lot of interest in teaching and education, just like all of your amazing teachers at Pereyma. And I think it's great for you guys to know that whether you want to or not, that learning never stops, right? So even if you're finished and have a job in, even as a doctor or a nurse or a respiratory therapist, learning never stops. And one of the fun things that I get to do is I get to be the medical director of a big simulation program, which is a great way to practice skills and think about teaching and think about changing things. And at the simulation program, I have a short video I'm going to show you guys. We do a lot of cool stuff. We get to work with mannequins that are high tech. We get to work with different care providers from the emergency department, trauma care, surgery, all around the hospital. And what we do is really we help teams come together to solve problems, take care of patients in a stressful, fun way. Because if you happen to be unlucky enough to need to go to the hospital, I'm sure everyone on this Zoom call wants to make sure that their doctors and nurses are ready to go. They're the best trained to do that. And so we actually host conferences and bring people from around the world to teach them how to be ready, how to simulate things, how to practice things. And so this video I'm going to show you, I thought it was pretty cool. It was put together by a bunch of the docs that ran this conference. It's kind of neat, and it sort of encapsulates what I do. So if you guys can bear with me, I'm gonna actually, let me just try to share this differently now. Can you guys see a black screen in front of you?
No.
No? Okay, give me a second. You're not the only one, Ms. Ashton, with issues around technology, so you're okay. Let's see if this works. Can you see that now?
Yes.
A black screen?
We can.
Awesome.
Doug, can you just check to see if there's anyone in the waiting room? I'm sorry to do that to you. In the waiting room?
Sure.
Can you check to see if there's anyone in the waiting room waiting to get into this Zoom call? Because
Yeah.
I don't have that ability anymore.
Okay, let me see. There's one waiting, Adam. I'm going to let Adam in.
Excellent. Thank you.
Thanks for reminding me that. I don't want to deprive Adam of some learning here.
He's very late.
It happens.
Yeah. Thank you.
All right, guys. So you can see this picture of this helipad on top of St. Mike's?
Yes.
Okay, so we'll have a couple of minutes of video here to set the scene about what I am lucky enough to get to be a part of. Hope you enjoy it. Can you hear the sound, Trez?
Mm-hmm. Yes, I can.
Perfect.
Perfect. That was amazing.
Yeah, so that's just a quick example of the type of stuff that I do. And for those of you that might have joined late, the intro to that was that I'm a doc that works at St. Mike's, and I also am the medical director of the simulation program. And what's fun is that I get to host conferences like that and continually help doctors and nurses and therapists improve and practice their skills. And so that is a really fun thing that I get to do. And I get to do a little bit of the same with you guys today. So let me see if I can share the talk again. Can you guys see the slides?
Yes, we can see it. Thanks, Doug.
And let me just try to get it going again. So great. So, and some of you might know, even at Lake Ridge Health, there's a simulation program there. And if you've ever been to any big hospital, they're always doing these things to try to practice. So even if you're in high school or just learning first aid, for example, today, there's always room for improvement for all of us, no matter how many degrees we have and all this fancy stuff. So happy to talk to you guys today. We're going to talk a little bit about what to do if you walk onto an accident scene. What kind of things should you be doing? What are proper procedures for a variety of medical emergencies? We're going to talk a little bit about CPR. And we're going to talk about how do you start giving first aid while you're waiting for help to arrive if someone is injured. And of course, you don't want to do anything more harmful to the patient by accident. And it's one of the things that all of us are a bit worried about when we come across a situation where someone might need some help. We don't want to do any more harm. And that's actually one of the mottos of all doctors when they get trained is do no harm, right? And so that applies to everyone who's giving first aid. One of the things I might just say, you noticed in that video I showed you, no one was wearing masks, right? That conference that was teaching people about emergency care and first aid was obviously before COVID. So it's one of the things I'm going to try to weave into the talk today. How do we give first aid in the pandemic? So quick question here, guys. See if you don't have to shout it out loud. Just say it to yourself, and we're going to do a quick pre-kit quiz. So after an accident, the idea is to immediately move someone to a comfortable position. You guys think about that. If a person is bleeding, use a tourniquet. You may not know what a tourniquet is, but we'll talk about that quickly today. Do signs of a heart attack include shortness of breath, anxiousness, and sweating? I see some nodding heads. I'm scrolling through. You guys can also use the chat if you'd like. But and then burns. All burns can be treated with first aid. No one needs to go to the emergency department if they have a burn. It seems a little suspect, that last one. So let's just see here. So should we move them to a comfortable position immediately? No, we shouldn't be doing that. That might be doing more harm by taking someone and potentially worsening, like a neck injury, for example. If a person is bleeding, use a tourniquet. Not necessarily. The tourniquet, for those of you who might know, is this fancy ring that we use to tighten a bandage. You don't have to have a tourniquet on you to help someone who's bleeding. Heart attack. I saw some heads nodding. Those are signs of a heart attack. So it doesn't need to be chest pain. It could be someone who's suddenly short of breath, looks really worried and is sweating all of a sudden. It's typically not someone as young as you guys. Someone maybe as old as me or even older. That's typically where it's going to happen. And then the burn question. First aid can help some burns, but a lot of them do need emergency medicine. So what do you do if you come onto a place where there's an emergency, where someone's bleeding or choking or clutching their chest? And you guys, each one of you guys on this conference can actually make a difference. You guys, and maybe some of you have already and learned already from it. So there's 4 basic rules. Call for help. Even in the hospital, when I'm teaching these really smart doctors and nurses, the first thing I teach them is to say, call for help. Because there's always better if you have a lot more brains helping you. And even in the hospital, we do that. So you can imagine if you're out in the street, if you're on Ritson, right in front of your school, someone drops in front of you, you got to figure out how to call for help. And usually the best way is to send someone to do that. Thankfully, most people have phones these days, so it's a good way to do it. Call 911. Get help to come to you, right? Check the ABCs. You guys know what the ABCs are? See some nodding, right? Airway, breathing. What's the last one? Circulation, right? So that's always a good thing to check and do no harm. So at the scene, what can you do? So if you're in the middle of the street or on the sidewalk, check around you. Is it safe, right? If someone is lying in the middle of the 401, you're not going to jump out, go grab them, right? There's a billion cars going by. What's the safety? Is there any risks? Is there something dangerous nearby? What do I need to do first? Most of us are human, right? When we come to a scene, we kind of freak out a bit. We might freeze. That's okay, right? Things to think about. Actually, at this point, we should probably talk about COVID. Like, you can't just run up to someone and anyone nowadays if they're not wearing a mask or if you're not wearing a mask. We have to be cognizant of that, right? So before you get close, you should put a mask on if you don't have it on. And what they're recommending now, if you come to someone who's unconscious or who's passed out, you should probably put a mask on them. So that's something new that we haven't really thought about before. Do quick head to toe check. So any obvious injuries that you might not have seen right away. Are they bleeding from their leg? Do they have a broken leg? Do they have a head injury? It's not that you need to fix everything right away. You just need to get a quick check of what's going on. And in general, we don't like to move someone if they've dropped in front of you or if you come across them. If you know, you have to balance that if there's an unsafe environment, and we can talk about that later if we have time. So first aid and in the time of COVID, you guys are all pretty COVID aware. This is going to be a new normal for you guys. It's probably harder for us older people to get used to this, right? But be aware of the risks to yourself. You're no good to anyone if you get yourself COVID. So you got to be conscious of that. You got to keep yourself safe. So that usually means putting on a mask and then thinking about what else you can do to keep you safe. And one thing would be to put the mask on the other person. Maybe they're not able to do it themselves. Provide first aid when it's safe to do so. Right? And this may be some of you's first introduction to first aid. Take a course. You know what? In the hospital, we train people every week, every month, because even the best people need constant training. So I really encourage all of you to keep taking courses, virtual or otherwise, so you can get trained and keep remembering things. Because most of us, it takes 100 times to learn something. So today's no different. So if critical intervention is not needed, so if they're breathing, they're talking, you want to just be careful of COVID. So are you safe to help them? Are you having a cough lately? Are you sick? Have you been in contact with someone who's COVID? Because you may not be the best person to go help them. If the person can't help themselves, if you don't know if they're breathing or talking, put on a mask, wash your hands ideally, and remind people to be careful of COVID. And after you're done everything, hopefully you guys have some hand sanitizer on you in your bags or in your knapsack or in your pockets. You know, wash your hands again. And if it's messy, you're gonna have to replace that mask. And what I tell everyone, and even in my car, I've got a couple of these first aid kits. Have a kit. Think about getting ready, whether it's your knapsack or car or whatever. Have at least 3 masks. Have some glasses or goggles ready. Have some hand sanitizer ready. These are good things to have in every car. Tell your parents to get their act together if they don't have it, right? This is really important. And so it's not just doing all the fancy stuff, it's keeping yourself safe. So let's talk about sort of the thing that I worry about if I came on a scene. What if someone's not breathing? What if they don't have any pulse? What do we do? Right? What do you guys think? Can you guys let me know what are things you need to do? Shout it out.
Sure, guys, you can unmute and then just shout out what you think.
Tell Doug to check.
Oh, and Doug,
Yep.
can you check the waiting room one more time? I'm sorry to have
I
you.
did. Yeah, I did. I'm letting some people in.
Oh, thank you so much. Thank you. Okay, I know that we were talking in our healthcare class, we were talking about vital signs last week. So I know that some of you know the answer to this. What do we do if there's no breathing or no pulse? What do you think?
I'm not sure, but maybe like CPR, like.
Great. Yeah, great answer. We're going to talk about that. Any other answers?
If there's a defibrillator in the area, maybe you could use that.
Yeah, awesome. And we're going to talk about that too. Great suggestions, guys. Don't forget, right? Make sure you're safe. Coming on to someone, call for help, right? You know, these sound basic things, right? But you'd be surprised how we often forget. So make sure the situation's safe, get yourself safe, call 911. And then someone rightly mentioned a defibrillator. So go get one. And you'll see in the video, another video I'm going to show you about how you might do that. Put on a mask and gloves if you have them. And maybe even for the other person. So AEDs, I'm sure, do you guys know where your defibrillators are in your school?
Mm-hmm.
Yeah?
No, guys, I know. They're by our gym hallway, like the gym entrances. Did you guys, I hope you know that. If not, now you do.
And it's always a good reminder, right? Because we're all human. We all forget we're busy. We're on Zoom half the time or some other platform that your teachers are using. I'm on Zoom a lot. But you got to know where your defibrillators are because these are all important things. So ideally, you want them, if you're going to have to give CPR, so if they're not breathing and you assess the situation, you might talk to them, might yell at them. You get yourself safe. You might try to move them quickly. Are you awake? Can you hear me? You're going to have to give CPR. So the first answer was a good one. And you have to put them on their back and give chest compressions. So that's a scary thing to do, right? So again, these pictures are all pre-COVID, right? So we don't have masks on these people, but we need to have masks on. And you need to tilt their head back so that they can breathe a bit easier. Right? Before COVID, we used to have different ways to help people if they were unresponsive. We'd have to breathe and give chest compressions in a perfect world if you had two people. But, you know, today's world, if they're not breathing, they're not responsive, you just give CPR. You assess the situation, you call for help, you send someone to get a defibrillator, and you start CPR. Scary, but it's really important because when the EMS or the paramedics arrive, if you're given CPR for 5 minutes, you probably just saved that person's life. Huge. So let's see if this video works. I'm always worried that these don't work. See if it, straight off good old YouTube. Can you guys see that?
No, we can't.
All right, I'm gonna stop and share again. Can you see that?
Yeah, now we can see it. We can see it, Doug.
Good. Just get the screen bag.
Awesome. Perfect. You can see it perfect.
This could be the library, right? Not that you guys are probably allowed to go in the library nowadays, but this could be anywhere in your school.
Are you okay? You, call 911. You, get an AED.
This is a scene that plays out over 1,000 times every day in the United States. If you see or find an adult or teen who has collapsed, they could be in cardiac arrest, and you need to act now. Assess for any signs of movement or normal breathing. If the person has slow, deep gasps, this is not the same as breathing. Call 911 or direct someone to call. Treat. Press hard and fast on the center of the chest. Place the heel of your dominant hand directly on the center of the chest and interlock the fingers of your other hand. Keep your arms straight and lean over the victim, using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second or 120 times per minute. Allow the chest to recoil completely with each compression. If the victim is on a soft surface, like a bed or a couch, move them to the ground before beginning compressions. You may have heard in the past that you must do mouth-to-mouth ventilations. Mouth-to-mouth is not needed for adults or teens and could be harmful. Perform chest compressions only. However, mouth-to-mouth is needed for young children and infants. While performing chest compressions, direct someone close by to get an AED. The AED, or automated external defibrillator, is the only thing that will shock the victim's heart back into normal function. When the AED arrives to the victim, simply turn it on and follow the voice-guided instructions.
Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
The AED will only deliver a shock to someone who needs it, so do not be afraid to put it on anyone who is unconscious. Now that you know how to act, let's watch this again.
All right, so that is a pretty cool video. And just so you know, I am going to share the slides with Miss Ashton. And so you guys can access this video and all these slides afterwards, okay? So
I'm
happy
so
for
happy to hear that. Thank you.
So let's get back. You guys can see the slides again, right?
Yes.
Awesome. So you saw that student giving compressions, right? You have to push hard. It's scary. I would actually even say that person in the video doing the compressions was probably not pushing hard enough. It's even with the doctors that we train and the nurses, we're constantly telling them to push harder. And you heard the defibrillator and its lovely little voice say that, right? Push harder. And some of them, depending on your defibrillator, will coach you through compressions if you're giving it right. So you got to push hard. You got to have your palm of your hand down in the middle of the chest. If you're not doing it perfectly, don't worry about it, right? Doing something is better than nothing. And just remember, we don't do mouth to mouth or breaths for teenagers or adults, right? We don't do that. Keep yourself safe. Remember that. The only other thing I would say about compressions is you got to let the chest come up. So when you're pushing down, if you push and you sort of don't let the chest come up, you're going to actually not give the lungs a chance to get in air or oxygen. So you got to push down, up, push down, and push up. And what people do actually is, and we'll play this again at the end so we can sort of get a recap, because I think it's the most important part of this lesson, but you can take turns, right? And it's because it's tiring. And sometimes in the hospital, we do compressions on someone for an hour. So that's tiring. I don't care how strong you are. You take turns and you switch out. So we'll show that video at the end because I think it's one of the more important take-home messages for you guys. Okay. All right, bleeding. Oh, by the way, before I go on, has anyone given CPR before? No, I'm not surprised. It's a scary thing if you have. The other, it depends. Don't want to gross you guys out too much, but typically when you're giving CPR, especially to someone who's older, you'll hear ribs break. And I know that's kind of hard to say, but it's a sign that you're actually doing it right. Because remember, this person may die without it. So it's better to have a broken rib than obviously to be dead. All right, let's move on. We're going to talk a little bit about bleeding now. And again, bleeding is something that's tough for people because a lot of people are freaked out about it. Many of us will pass out or feel faint if we see someone bleeding. But it's important to just remember simple things before helps arise, right? So obviously you want to stop the bleeding, because if you put pressure on the source of bleeding in a safe way, the body's actually going to take care of itself. The body's going to help put in mechanisms early on to stop the bleeding. So you can really stop the flow of blood by direct pressure. Wear gloves, right? Why would we wear gloves when we're stopping someone bleeding. Any thoughts from you guys?
Just in case you have like an open wound on your hand, you don't want their blood getting in theirs and then you getting infected.
Amazing.
That was an awesome answer.
Great answer. Anybody know what type of infections you might be worried about? Things like hepatitis or HIV could theoretically be transmitted, right? So really good idea to wear gloves and protect yourself. That's really good answer. Okay, so you want to cover the wound. I mean, and I know this sounds silly, but you sort of use anything you can. If you can get someone to get help, someone's hopefully called 911. Maybe you can ask the third person, or someone else can say, "What can I do to help? Can you get a first aid kit?" Maybe someone has some stuff that they can bring. You guys might even have a first aid kit as well as an AED at your school, right? So get that to be brought, because there might be some nice big cloths in there that you can use to cover the wound. And I'm sure you guys do, right? Probably in your shop. Where else would your first aid kits be? Does anyone know?
In the main office.
Right.
We have,
Main office would be key, right?
and
Lots of stuff in there.
Mhm.
And again, some people have a first aid kit in the car, and it's not a bad idea, just because you never know when, if you're driving around or if you're with your family, you might need it. All right, so apply pressure. Sounds simple, right? But assess the situation. If they're bleeding, get your gloves on, put a bandage or a gauze, or if you don't have any of that, just a rolled up towel or a shirt or something, and just apply pressure. Push on it. And this sounds gross, but if someone's lost a leg or a lost part of a leg, ideally you put it in a bag on ice, right? And it sounds really gross, but it's actually important because they can sew that back on. You never know. Shock. Okay, so this word is used to describe people that are, really sick, and they could be sick from a number of different things. Some people get into shock if they're bleeding a lot and they've lost a lot of blood. Some people can be in shock if they actually get an electric shock from something. But in this case, if you see someone who's really cold and clammy and they're talking, they're breathing, they may be in shock. They may have some other problem you don't know about. And so if they're breathing, they're talking, they seem okay, but they're really pale, they're sweating, you could still really help them, right? So you're going to assess the safety area. You're going to keep yourself safe. You're going to call 911, get some help. But you might want to lay the person down, cover them. They might be cold. Often people in shock will shiver. Even if it's warm outside, it's not because of the temperature outside. It's because their body's response will go to in a sort of like an automatic play mode, where they start to sweat and they shiver. That's part of the autonomic nervous system's response. So it's your body's known response to a condition. So cover them with a blanket or a jacket or something that you might have, and raise their feet. Why would we raise someone's feet in shock? Does anyone know? It's a tough one, right? It's like, well, how would that help? Well, believe it or not, if you raise your feet, and this time someone used a first aid bag, it looks like, but you actually might be able to help their body return blood back to the heart. One of the most common causes of shock is that the heart actually is not getting enough blood back to pump around. So the heart's like, oh my gosh, I don't have enough blood. And so the person's brain doesn't get the right perfusion, and their whole body isn't getting the right perfusion or flow of blood. So just by raising the feet, you actually can help that person a lot. So again, that's shock that would be appropriate if you saw someone who seemed to be breathing, is talking to you, but looks cold and clammy, looks really sick. And maybe shivering a bit. This is where you would do those things. Anaphylactic shock. What does that mean? I know it's a pretty big word. What does that mean, guys? And my bet is that one or two of you on this call is probably at risk of this.
It's when you're like allergic to something and then you eat the thing you're allergic to and you go into anaphylactic shock.
Awesome. Great answer. You're absolutely right. What's the most common cause of anaphylactic shock, do you guys think?
Peanuts or penicillin?
Yeah, great answer. Ms. Ashton, this class is rocking it today.
Aren't they great?
Pretty good.
Yeah.
Absolutely. So for, especially in a school setting, peanuts would be your most common cause. I really like how you said penicillin, because medicines is probably the next most common cause, especially if it's someone old. So peanuts could still be there, but if you find someone randomly who's having an anaphylactic or severe allergic reaction, medicine, and that's why there's a picture of a medicine vial here. So anaphylaxis is sort of a fancy word for an allergic reaction that's the body is freaking out about. So not only do they have hives and their breathing might be compromised, but actually their blood pressure is low. Their heart's not working great, so they can die actually pretty quickly, which is scary. And this is when you might need to give them rescue medicine. This is a pretty easy one. So what kind of rescue medicine would you need? And how do you give it?
An EpiPen?
Yeah. Has anyone given an EpiPen before to a real person? No? Any tricks? How do you know how to do it?
Blue to the sky, orange to the sky.
Love
The
it.
commercials.
Love it. That's exactly it. That's, and we even have one in our clinic that is ready to go. So it's blue to the sky, right through clothes, whatever. Like you just jab it in a big piece of muscle, usually their leg, or their arm if they're big, right? It's really as simple as that. And that could be life-saving. And don't forget to call 911 as soon as you do, because just because you give them a dose of epi, they might need more. They might need other medicines, so they got to get to the hospital. So really important. Some of them are to the point where they'll stop breathing on you. So if you see something happening like that in that sequence, guess what? You got to start CPR again. Heart attack. Okay. We're not going to spend too long on this because we don't have too long, but again, basic things, right? Heart attack, it's a scary thing to watch. Usually someone will just clutch their chest like this, and they'll get really clammy and cold and pale, and they'll often stumble around, try to sit down, and they may fall to the ground. So call 911, right? Get the victim comfortable. People who have a heart attack are usually still talking to you. They're not unconscious, they're still breathing. Okay, so that's another one that's different than the no breathing, no pulse type patient. Some people say, how do I know how do I tell apart the heart attack from a shock? It's a good question. It's not always easy, right? So this is where sometimes you make them comfortable, talk to them. What are they feeling? What are they feeling like? If my chest hurts, or, oh my God, my heart is racing, that might be a heart attack. So you want to make them comfortable. You want to loosen some clothing. You want to see if they have medicine. Now, I wouldn't expect anyone in this call to know what medicine a person might have on them to help. Does anyone know?
It's aspirin.
Aspirin, that's amazing. This is a great class. So aspirin is definitely one that they might have. So someone who's at risk of a heart attack often walks around with aspirin in their wallet or their purse. Any other medicine? I would really literally quit the call if you guys get this.
I know
Nitroglycerin. Have you heard of that?
Yeah.
So that's, I think I might have cut off Miss Ashton there. Did I cut you off there, Miss Ashton?
That's okay. I was, I'm practically a doctor, so I was going to say that.
Oh, there you go. I got to give some up to you. So people, again, who are at risk might have nitroglycerin, and then that typically goes under the tongue. Now, again, I don't want you going around giving medicine to people that you don't know if they need it, but these are, in general, the person, if they're breathing and they may be able to talk to you, they might help you, right? And you may be able to help them with their medicine. But remember, keep yourself safe, wear a mask, put a mask on them, right? Because you don't want to get too close because of COVID that we're dealing with. Keep the victim still. This is a kind of a weird one. I don't think you should be like tying the person up or anything. It's more keeping them comfortable and calling 911 and getting some help. And I don't know why they put this either. I'm not sure anyone has stimulants and in their pockets, so don't worry about that. Choking, I'm sure everyone's choked on this call, right? I'm sure everyone's choked. But what's this person doing to this child here?
They're called J thrusts.
J thrust, love it, right? So, and what are they doing the thrust for?
Because there's probably something blocking his airway, so they're trying to get it out.
Yeah, exactly. And so there's something lodged in their throat. And so it's hard to see, but I don't know if you can see her fist is inside her paw, her other hand. So her right hand with the ring on it is covering the fist. And the idea is to ram that fist up under the diaphragm to put pressure on the lungs to push out whatever's stuck there. So that's called a J thrust for sure, or an abdominal thrust. So someone's choking, you say, can you speak? Can you ask them to speak so that because if they're speaking, they're not in serious danger. Can they cough it out? Because sometimes they can do it. So 5 back blows doesn't usually work in an adult. So I tend not to go around and start whacking people in the back if they're choking. First thing, most important, can you speak? Because if they can speak, they can they're fine. You can get some water. Can they cough? Yes, they can. If they can cough, they're fine. So I tend to go straight to the abdominal thrust or the J thrust. And typically the abdominal thrusts are by themselves the most effective, unless it's a small child, an infant under the age of 1, then back blows might actually help. And this looks gross too, especially in the land of COVID now. Whenever I see this picture, I'm like, oh my God, get a glove on, get a mask on, because it's not as safe as it used to be. Clearly, you hopefully would have called 911, but this is what we would call a finger sweep. And if you do thrusts and the person seems like they cough something out, this is something that I would only do if I had a mask on and I had lots of gloves. So if you don't have it, you just wait. You want to keep yourself safe. Wait till the ambulance paramedics get there. And abdominal thrusts, because if it's not working, still give more. Again, this would be a choking situation is when you see them with that choking sign around their neck, or if you just witness them choking. You're not going to go around giving abdominal thrust to people who are just randomly passed out because they're probably not choking. Check their airway, check their breathing. And then if they're not breathing and you think they've choked, but you've done everything you can, you may need to perform CPR. Electrical shock, not super common. See someone next to a big wire or right next to some electrical box, don't touch them. Call 911, right? Get some help. Turn the person off, ideally. I wouldn't be touching any live wire unless I had gloves that could protect me from doing it. So I don't recommend doing that. Check for breathing. This guy doesn't have his mask on. So quick little test before we watch that CPR video. If we have time, just mindful of time. We have about 10 minutes, right, Miss Ashton?
Oh, we can go a little long. Like we actually have till 2:15.
Oh, okay.
It'll take too much of your time.
Yeah, I have a Zoom at 2, so I'll do my best because I'd like to open up for questions too. So
thank you.
Okay, so let's go through here. It's pretty straightforward for this group. So which solution do we have if someone's bleeding?
Direct pressure.
Awesome. Choking? Hard to forget this one, right?
Yes.
Awesome.
Excellent. Good.
No breathing?
CPR.
Yes. Awesome. Heart attack?
AED, something like that.
Sorry, what was that? I missed that.
Keep victim still.
Amazing. And then even I could get this one. If they're in shock, keep their feet up. So, we talked about things for no breathing. What we didn't talk about the no breathing is you want to check a pulse. Again, if you're safe, where would you guys feel a pulse? Where's the best place to feel a pulse in someone?
Your wrist.
Wrist would be one. It's probably not the best one.
Your neck.
Yeah, awesome. And what's the big artery that takes the blood up to the brain and the neck? The bonus points.
Carotid.
The carotid. These guys are stars.
We've been taught to do it in the wrist and not to do it in the neck because
Have you?
of the
Okay.
issues with closing the artery and keeping blood flow off from the brain.
Yeah, and that's probably a pretty good strategy. And nowadays, one of the reasons you don't see check the pulse in these guidelines is because they don't want people to spend too long trying to figure out pulse or not. They want people to give CPR. Because if someone's not moving, they're not breathing, you can't wake them up, they're not talking to them, they're lying in a weird spot, they want you to start CPR. Because sometimes, the pulse, there may be a pulse or you think you might feel it. And if people are messing around and not starting CPR, that can be a problem. So that's one of the reasons. Heart attack, we talked about choking and shock. So I'm going to just switch again to that other video so we can just recap, because I think it is helpful to recap that. And then I'm going to take some questions from you guys. Oh, let's see here.
Did you do attendance for SHSM kids? Did you get Leah King?
I'm just going to fast forward to that recap part.
Is unconscious. Now that you know how to act, let's watch this again.
We don't see it yet, Doug.
I don't see it.
Yeah.
Okay.
Yeah. Sorry, hon.
Thanks for that. See it now?
Yes. Thank you.
Are you okay? You, call 911. You, get an AD.
See how she's pointing? It's really good to point.
Keep your
and
arms
speak.
straight and
Well,
lean over the
everyone knows
victim,
what
using
they're
your
supposed to
body
do.
to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second, or 120 times per minute.
She's not bending her elbows. She's pushing from her shoulders, which is great.
Responsiveness. Call for help. Attach defib pads to patients to the chest.
And if you're the person calling on one, come back and tell them you've called. There's nothing worse than someone running away and then you don't know
Touch
if they
patient.
did that.
Analyzing. Shock advised. Press flashing shock button. Shock delivered. Start CPR.
In many instances, an ambulance or other medical professional can be 5 to 10 minutes away or more. Continue chest compressions while rotating compressors every 2 minutes until help arrives, and continue to follow the instructions of the AED or 911 dispatcher. You be the hero. Teach your friends and family to act now.
All right, guys. So that's it for me. I'm happy to answer some questions.
Yep.
Today, we're talking about CPR or cardiopulmonary resuscitation.
Good.
All right. Is that better?
That's perfect.
All right. I'm happy to answer any question you guys have about anything.
I have a question.
Okay.
Is the shock that we learned about today the same shock some mothers go through after delivering?
That's a good question. So we learned about shock today if someone's lost a lot of blood, right? And so after a mom has a baby, they often lose a lot of blood. So that's exactly right. And in the hospital, and I actually work in the baby area. So lots of times women, they literally lose their blood pressure. They lose so much blood that they almost go unconscious. And the first thing we'll do is we'll raise their legs.
And can't some even go into seizures?
Yep. So their heart can stop. They can literally stop breathing. And if their brain doesn't get enough oxygen or blood, they'll seize.
Mm-hmm.
So there's lots of causes of seizures. We didn't talk about seizures today, but that's another common issue. And so, yeah, but mothers who give babies if they lose too much blood, they can go into seizures. Yeah, absolutely. Good question. Anyone want to come work in the sim lab that I work at? Yeah. Yeah, it's a cool job. You know, it's a big career now. You don't have to be a doctor or nurse even, or a clinician. You can work as a simulation specialist. We have 6 people that went to college, did some training in healthcare and simulation, and now they work helping doctors and nurses keep patients safe. So it's kind of a cool job. So there's lots of new jobs at the hospitals to think about. So yeah, so think about it. Talk to your teachers.
Awesome. Thank you. Does anyone else have any questions?
I have a question. I was just wondering earlier, you were talking about in the PowerPoint how if someone has a heart attack, to put them in a comfortable position. But what is a comfortable position when someone's having a heart attack?
Good idea. A good question. It's tricky, right? And again, you're as a first aid responder, you're going to do the best you can to make the best judgment you can. So usually someone's having a heart attack, they're clutching their chest, they're uncomfortable, they're breathing hard. They'll sit down. That usually be the first thing that makes them feel better. It feels like someone's sitting on their chest is what often they'll be described at, or pain radiating down the arm. So typically sitting for them is the best. The problem is that if their heart stops, you want them on their back to give CPR. So what we typically will do is lie them on the ground, on their back. I might put a soft rolled jacket or something underneath their neck, again, keeping them safe with a mask, myself safe with a mask. And they should be more comfortable in that. Lying down on the ground will help the body get more blood back to the heart, and it will help perfuse the heart with blood. A heart attack is a problem with the heart muscle not getting enough blood. So just by lying them down, it may help. It may not fix it for sure, but it's worth a try.
Awesome. Doug, I remember it's been a long time since I've done my CPR first aid training, but I thought there was a shock position where you would roll someone on their side. Do we no longer do that, or do you just have them on the back still and raise the legs? Is that
still on their back and raise their legs? For a patient with a seizure, you may, or having shaking, seizure, epilepsy, it's probably a good idea to turn their head to the side, roll them a little bit on their side with their knee over onto the ground. Yeah. That puts them in a safe position in case they threw up, because then they can, if they throw up, then they're gonna it's not gonna endanger them. So the only thing with lying down is if they're vomiting, they could choke on that. That is true. So, it's something that's tricky. You can't account for everything. You can't, no one has a crystal ball. You do the best you can. The biggest thing, again, the most important thing is probably those first few slides. Assess the situation, call 911, get some help. Ask, use your brains, work together as a team. Ask the person if they might know, right? The other thing we have to talk about is if someone's unconscious and unresponsive, we haven't talked about it yet, but they could have had an overdose with opioids, right? So fentanyl, heroin, medication that they're using for pain, that could be the issue. And that's not something that's always going to easily be understood. We actually run a course at St. Mike's where people who've witnessed opioid overdose, we teach them using simulation how to help their colleague, their friend, their mother, their brother who might have an addiction or might have a problem, how to revive them. It sounds crazy, but it saves lives. There's now something called Narcan or naloxone, which is available in either an injection or in a spray that goes up the nose. And so it's not really well understood yet, and it's beyond the scope of this lecture, but soon CPR, because there's so many people that are dying of opioid overdose, unfortunately. Lots in Oshawa, lots in Toronto, everywhere, unfortunately. And so CPR is probably going to change that. We're going to think about using a spray, believe it or not. That's going to be the new part.
Doug, I know that if you go to the pharmacies in Oshawa, you can get a kit for free. My stepdaughter carries one in her purse. Yeah,
and that's a smart idea because it's so common now.
Yeah.
And Narcan, if you give it to someone who's not overdosed on opioids, is not going to hurt them. it's something that's not mandated or regulated, but I think it's stay tuned. And this is why you should take more courses and learn more about it, because it's coming.
Yeah. Keep taking this on and off. Well, we are probably gonna have to let you go as much as that I wish that we had more